Okay, let's continue. So we're talking about the second cervical vertebrae, which is also known as axis. Now, it is identified by the presence of the dens or odontoid process, which is basically a tooth-like process, and it's really strong and it projects upwards from the body. Now, dens is actually believed to represent the centrum. Centrum, also known as, is also basically the vertebral body. So dens is usually believed to represent the centrum of the atlas, which has fused with the centrum of the axis. So it's basically believed to be the centrum of atlas, which is fused with the centrum of the axis. Now, moving on, body and the dens. So the superior surface of the body is fused with the dens. The inferior surface has a prominent interior margin, which projects downwards, and the anterior surface, it represents a median ridge. Now, if you talk about the vertebral arch, so this is a pedicle, and for example, here you can see this. This is a posterior view. So here you can see the lamina in a better, orientation. So this is a pedicle. This is lamina. And the pedicles are concealed superiorly by the superior articular processes. So these are the superior articular processes. The inferior surface represents deep and wide inferior vertebral notch. So vertebral notch inferior is here, whereas the superior vertebral notches, they're very shallow. Now, moving on, you can see that the laminae are thick and strong. So the laminae are pretty thick and they're strong. The articular facets, each superior articular facet occupies the upper surfaces of the body and of the massive pedicle. Laterally, it overhangs the foramen transversatum. It is largely flat, circular facet which is directed upwards and laterally. It articulates with the inferior facet of the atlas vertebrae. Inferior facet of the atlas vertebrae. Now, moving on, this forms the atlantoaxial joint. Now, what am I trying to tell you here? That the superior articular facet of this articulates with the inferior articular facets of the atlas. So this forms the atlantoaxial joint. Now, the transverse processes are very small and represent the true posterior tubercles only. The foramen transversatum is directed upwards and laterally. So it also has the transverse process. They're very small and they represent the true posterior tubercles only. And the foramen transversatum, it's directed upwards and laterally. The spine is large, so this is a spine. It's large and thick and very strong. It is deeply grooved inferiorly. If you see the inferior aspect of it, it's deeply grooved. And other than that, its tip is bifid, terminating in two rough tubercles. So it has basically a split end. Now the dens, it's super important. It provides attachment at its apex to the apical ligament and on each side below the apex to the alar ligaments. Now for this I have a very good diagram right here. Okay, what is this? This is upper cervical vertebrae assembled posterior superior view. So superior articular surface of occipital condyle. This is atlas, right? And this is axis. So this is how atlas and axis they basically articulate with each other. So this is the dens. You can see how it's protruding and posterior articular facet for the transverse ligament of atlas. This is the posterior articular facet. Dens has a posterior articular facet which is for the posterior, which is for the transverse ligament of the atlas. This thing, let me just clear it in this diagram. Yep, better. So here you can see that this is the dens, right? You can see it and posterior articular facet of dens, which is for the transverse ligament of atlas. And here you can see that I told you, let me read this again, that the dens provides attachment at its apex to the apical ligament of dens. That's there. And on its each side, below the apex to the alar ligaments. So these are the alar ligaments. And this posterior articular facet of dens, it provides attachment for the transverse ligaments of atlas. Now let's think about all of this and formulate a proper explanation. So this thing, right? For example, this is your axis. Now here somewhere must be the dens, right? Now the posterior surface of dens, it has a posterior articular facet that is basically the site of attachment for the transverse ligament of atlas, not axis, right? Right now this is axis and odontoid process is of axis, but it provides attachment to the transverse ligament of atlas. So this is a transverse ligament. Then the same odontoid process, its tip basically it provides attachment for the apical ligament. And then the same odontoid process, its sides they provide attachment site for the alar ligament. So alar ligament is also there. Now this is apical and this is alar ligament. Now the alar ligament, it's you cannot you can see the alar ligament here, but you cannot see the apical ligament because it's behind this superior longitudinal band. And then yeah, so superior longitudinal band, this is the inferior longitudinal band. This is a transverse ligament of atlas which joins to the posterior articular point facet on the posterior side of the dens. So this is the cruciate ligament. It forms a cross like appearance, cruciate ligament. And yeah, so the interior surface of the body receives insertion of the longest collar. So similarly, even in the previous vertebrae, I told you that the anterior surface of the body it receives insertion of anterior longitudinal ligament, and then the sides of the longitudinal ligament they give insertion or attachment to the origin to the longest colli. So similar thing happens here, but instead of the origin, now it's the insertion. So longest colli it basically originated in the previous one I told you, right? And now it inserts here in the axis. So it originated from the atlas, uh, anterior longitudinal ligament. So yeah, another posterior surface. Sorry, the posterior surface of the body it provides attachment from below upwards to the posterior longitudinal ligament. Similarly, now the membrane and the membrana tectoria and the vertical limb of the cruciate ligament. So now there are two more additions. At the posterior surface of the body, it also gives attachment to the membrana tectoria. This one, membrana tectoria, part of tectorial membrane, and also to the superior longitudinal and to the vertical limb of the. So that's basically the superior and the inferior of the cruciate ligament. The laminae provides attachment to the ligamenta flava, similar to the previous one in which I told you that the laminae provides attachment to the ligamenta flava. So a similar thing is happening here as well. This is the ligamenta flava. The laminae provides attachment to it, and the transverse process gives origin to the tip of levator scapula, scaleneus medius. You can see here. So scaleneus medius, you can see it's going, and here. So the transverse process is giving origin to levator scapula, scaleneus medius, splenius cervicis posteriorly, and the intertransverse muscles are attached to the upper and lower surfaces of the process. The spine gives attachment to the ligamentum nuchae. So where's the spine? That's the spine. Let me find it. Yeah. So it gives attachment to ligamentum nuchae. And also there are a few muscles that are originating, so you can read that. Now the seventh cervical vertebrae. It looks somewhat like elephant to me. See, this is the elephant's trunk, this is eyes, this is its happy face. Now, seventh cervical vertebrae is also known as vertebrae prominence, because if you touch behind your neck, there's something that's really protruding out. It's really prominent. So this is the seventh cervical vertebrae because of its long spinous process, the tip of which can be felt to the skin at the lower end of the nuchal furrow. Its spine is thick. See, it's so thick, and also it's not split end, it's not bifid, but it ends in a tubercle. So there's a tubercle, and I told you that it is really thick and long and nearly horizontal. So it's nearly horizontal and thick and long. The transverse processes are comparatively large in size compared to the rest of the cervical vertebrae, and the posterior root is larger than the interior. The interior tubercle is absent. The foramen, there's no anterior tubercle. Sorry, there's no anterior tubercle. There was supposed to be an anterior tubercle here normally, but it's not here. And also the foramen transversarium is relatively small, sometimes double or maybe entirely absent. It does not transmit the vertebral artery. So this can be there or cannot be there, and even if it's present here, it doesn't transmit the vertebral artery. So these are few things. Horizontal, and this is very thick. It's not bifid. There's no anterior tubercle. And what did they say about the posterior tubercle? That No, they didn't say anything about the posterior tubercle. They're just saying that the transverse process is relatively large in size and the posterior root is larger than the interior. That's what they said. Now, moving on, attachments. The tip of the spine provides attachment to ligamentum nuchae. Again, the same thing. Now, and there are a lot of muscles: trapezius, rhomboid minor, serratus posterior, superior, splenius capitis, semispinalis thoracis, spinalis cervicis, interspinales, and multifidus. So you can read all of these muscles. And then also the transverse process, the foramen transversarium usually transits only an accessory vertebral vein. The posterior tubercle provides, so there's only accessory vertebral vein. There isn't vertebral artery here, only accessory vertebral vein. And also the tubercle, the posterior tubercle, it provides attachment to the suprapleural membrane. The lower border provides attachment to the levator costarum. The interior root of the transverse process may sometimes be separated. It then forms a cervical rib of the variable size. So that's about the 7 cervical vertebrae. And yeah, so they said that the cervical rib is an additional rib arising from the C7 vertebrae and usually gets attached to the first rib near the insertion of the scalenus interior. If the rib is more than 5 centimeters long, it usually displaces the brachial plexus and the subclavian artery upwards. The symptoms are tingling pain along the inner border of the forearm and hand, including weakness. Yeah. So that's about the extra, if there is an extra rib, right? And yeah, that's pretty much it. I hope you learned something.